continuing to keep a close eye on Washington, where there's a whole lot of political posturing going on, but little action. You know, we've talked about the closures and the furloughs, but this partial government shutdown is also impacting medical research right here in Western New York. Here's Dr. Peter Ostrow.
We do a lot of federally funded medical research in Western New York. Most of it is paid for by the National Institutes of Health, NIH. The government shutdown will have an impact on that.
It's not as if research comes to a grinding halt, but it really makes life more difficult. Some clinical trials that are happening that rely on a continuous flow of funds to make them happen, they'll be slowed down, and some of them will be stopped until the government shutdown is over.
Dr. Murphy is Senior Associate Dean for Clinical and Translational Research at UB. That's the kind of research that translates basic science into new drugs, new vaccines, new treatments. He also reviews grant applications to NIH from other scientists, and he's scheduled to go to a review meeting next week.
That's likely going to be canceled now. So all the people, the 70 or 80 people who have applied for grants to continue their research and to do the research that we need, their grants will not be reviewed.
Ongoing research won't stop, but it will be impeded.
In areas, for example, where we're making progress, in areas where studies are getting close to breakthroughs, in areas that are important in developing better treatments and new drugs and new vaccines and so forth, it all gets slowed down.
Medical research is important to all of us, and it's one of the things that will suffer during the shutdown.
And to me, it's very frustrating, quite frankly, infuriating that there are a lot of people on our end who are doing our job, but we're not able to do our job now because our elected officials, I believe, have failed.
Now, NIH does great work. They have a limited budget, and they award grants to pay for the most promising research projects. Some of those projects need to have ongoing communication between the scientists and the NIH staff, but during the shutdown, there's nobody to talk to.
Right.
There's no NIH staff there.
Well, and that research is important, but for someone who is receiving treatment right now, is that treatment going to be unavailable or delayed in any way?
Well, some people might have to wait to begin a clinical trial. Nobody's health, though, should be directly jeopardized by this. It's just that advances in healthcare are on hold.
Okay.
They're just waiting for the shutdown to be over.
So it impacts us all?
Yeah.
Thank you, Doctor.